Hey people, how are you doing this evening? I am Akeda Valletta, also known as the Body Scientist, and in case you don't know me, I am a sports nutritionist, an exercise physiologist, a cannabis medicine student. I've committed my life to studying all the ways to take our body to its highest level, and I'm live on my IG. I will save it, repost it to my YouTube, okay? So those of you who know me, you know that I'm really serious about holistic health, and I'm really serious about holistic health and like bringing our body into balance. And so I had to make this video really quickly because those of you, hold on, I'm working my master's in medical cannabis science, right? And some of you have heard me talking about this a lot and the different applications. There's so many different applications. And a lot of people don't take it seriously. They think, oh, cannabis medicine. They think like it's a joke because you're always hearing about cannabis helping with a variety of issues. But I want to tell you that the bulk of the people that I've been working with lately have been older people, okay? People who are over 70. And I find that cannabis is, you know, I was almost in tears just now because there's so many people in my family and friends of, you know, family who are dealing with serious ailments, okay? And they're older people and they're being put on all these medications. People love to dump drugs on the elderly and children. And funny enough, children and the elderly often need the same things, okay? But I'm listening, you know, I had one aunt that had a stroke, okay? She's in her early 80s. She was always very fit, always exercised. She doesn't even look, she's 84. She doesn't even look like it, okay? She looks like she's like 60, okay? She looks amazing. But she did have a stroke. And she's pretty much okay with her functioning. She has some, you know, things. And, you know, cannabis is very effective at, you know, helping to regenerate brain cells. And people have like personality issues and just brain issues and cognitive issues, okay? Then, you know, I have an aunt right now who is she's in her upper 70s, okay? No, sorry. She's in her mid 8, she might be like 86, okay? Damn, I didn't realize she was that old. But yeah, I think my aunt is like 86, and she has cancer. And my mom was just talking to me about how it was hurting for her to swallow. And you know, they're trying to give her all these medications because when people have cancer and they're going through chemo and radiation, they end up getting put on a lot of other medications, okay, to counteract the effects of chemo. So they end up getting put on antiemetics, which are drugs to help counteract nausea for people who are nauseous. They get put on painkillers. They get put on sleeping pills. All these other medications to counteract the side effects of the chemo. Okay? And chemo destroys your gut. All right? Now, cannabis, and a lot of people will tell you that there's not a lot of research when it comes to cannabis medicine, and that's true and not true, okay? I could do a whole talk on that, and I'll save that for my OnlyFans page, The Body Scientist, where I do my case studies and I go more in depth. I'll save it for there because I don't feel like most people will even care for me to go in depth like that about research. But there's different kinds of research. Let me know if you guys can hear me, because somebody called me. So let me know if you can still hear me. Hopefully you guys can still hear me. Let me know. So, there's been most of the research with cannabis medicine, a lot of it has been with how it can help cancer patients, okay, just be more comfortable. Okay, there's a lot about how cannabis can kill cancer cells, but without even going that deep into trying to cure something. All right, even if we just keep it at the level of trying to help a cancer patient be more comfortable while they're going through chemo. Right now, because people are at different places with things and what they are willing to do and what they, you know. So for me, if I had cancer, I would be using cannabis I would be using cannabis in conjunction with other herbs and foods to try to kill the cancer and get rid of it, right? Other people, their goal is not that, it's just to be comfortable, okay? So they don't have to be so in such agonizing pain and discomfort as they're going through chemo. And even talking about this is making me like, I don't know, it's making me want to get teary-eyed because I hate seeing people suffer, you know? And the thing is that, you know, cannabis, a lot of the research when it comes to cannabis being used for cancer patients, just to help them, even people who are in hospice, okay, just to help them to be more comfortable in that space, okay, and to not be put on all these other toxic medications for the pain, for the nausea that can kill them, okay. When you use cannabis can be used for the pain. Cannabis can be used for the nausea. Cannabis can be used to go to sleep, okay? All of those things. Except cannabis actually helps your body heal, okay? It doesn't cause all the terrible side effects that the medications do, and a lot of times it's more effective. There's a nurse, and I should get her on to interview her. Thanks, love. I appreciate that. There's a nurse in Chicago who I interviewed in my first semester in my grad program. And she's a nurse practitioner, and her whole entire practice is about getting people who are have serious illnesses, okay? Children and adults who have serious illnesses of a variety, cancers, it could be autoimmune stuff, it could be autism. Her practice is around taking them and getting them off the meds, off the pharmaceuticals, and using cannabis medicinally. There's also a doctor in Virginia who she has something to do with my program. I met her on Clubhouse. There were great conversations on Clubhouse with pharmacists and nurses and doctors who are very knowledgeable about cannabis medicine and very experienced. And this doctor, she's an older black woman, Dr. Fry, in Virginia. And I remember hearing her before I even came in this program. I was listening to the conversations from the scientific cannabis medicine conversations, and she consistently talked about the fact, oh, this is the thing, let me skip back. A lot of people are unaware of the fact, okay? A lot of people are unaware of the fact that the FDA has already approved medications, okay, that are imitation CBD, imitation THC, another one that is an extract of cannabinoids, okay? The FDA has already approved that to be used, okay? And one of them is called Marinol. And I remember Dr. Fry saying, because her practice, she takes people who are severely ill and are on lots of medications, okay, and gets them off of it, weans them off of it, and uses cannabis instead. Because one of the things, when people use cannabis and meds together, research has shown that a lot of times they can decrease the amount of the meds that they're, like, let's say they're taking opioids. They can take a lot less of the dose when they're using cannabis, or maybe wean themselves off it completely, okay? And this is one of the things that I will be doing in my practice, because I already, as a nutritionist, okay, and as an exercise physiologist, have already been doing this work. I've already been working with people with a variety of things going on with their body, people who might be on medications. Medications bring side effects and other things, and so this is something I've already been doing. Now adding cannabis to the mix, right? So Dr. Fry said that it was known that the Marinol, which is the FDA-approved THC cannabis drug, was not as effective, okay? It was not as effective as actually using cannabis. And the nurse that I knew in Chicago, she said that she worked in this cancer ward in the hospital, where she had to administer Marinol and the FDA-approved pharmaceuticals that are based off of cannabis. And she said these cancer patients, all they would tell her was all they wanted to do was smoke a joint. They wanted to smoke. The Marinol was not helping their nausea. And she said that they couldn't smoke because they were hooked up to oxygen tanks, right? They were hooked up to oxygen tanks, and their shit would explode. Now, edibles is also an option, but I don't know. Myself, I find for nausea, smoking helps the most. I don't know if edibles, will help, because when you're using cannabis medicinally, it depends on what you're using it for. There are many different factors, right? But when it comes to older people, like I have a long list of things I could go through with people who are over 70, and they have been the largest group of people that I've worked with when it comes to medicinal cannabis. So, getting rid of this stigma, because it really is effective at, alleviating people's pain and discomfort, their nausea, their inflammation, their swelling, all of the things, okay? And I've done videos in the past where I talk about our endocannabinoid system, and I have other videos where I get into the mechanisms of action and how cannabis works to help all these things, because it's not a joke, it's not a game. People aren't making it up. And there wouldn't be a master's degree program at the University of Maryland in medical cannabis science and therapeutics if there wasn't a lot already, okay? And there's a lot I knew before. There's a lot I've learned in this past year. And I'm going to know even more by next year when I graduate, right? But, I'm talking to my mom. She's telling me my aunt, they wanted her to get some medication to counteract her chemo symptoms that cost $1,000. And it's like, she lives in Pennsylvania. Pennsylvania is actually a medical cannabis state. And everybody should have a medical cannabis card. Even if you don't smoke or you don't consume, you should have a medical cannabis card in case you need it. And because then you don't have to pay the taxes. You can, some states you can only get it if you have a medical card. And getting weed from the weed man, that's not like, if you're really trying to use it medicinally, there are certain products that you might need, certain concentrations, certain strains, certain things that you can't just get from calling your weed man. And I did a video already about why I go to dispensaries now anyway, because all this fentanyl mess. I don't trust that we won't see people dying from weed-laced fentanyl. How do you get a medical cannabis card? It depends on the state that you're in, okay? The way it usually works, every state has different protocols. The way it usually works is that you have to get some kind of certification from a healthcare practitioner, okay, a doctor or a nurse, okay, and you have to have one of the qualifying conditions. Every state has different qualifying conditions. Some states got 10, some states got 20, okay. One of those qualifying conditions, and you get certified by the medical professional, and then usually you have to submit that to the state and pay a fee. And then you get a card, okay? And then you have to renew it every year. I think you can pay for it for 2 years. So I'm in the midst of getting mine, just because, going through different states. Some states you need it. Also, when you do have it, you don't have to pay all the taxes, okay? And I do use it medicinally. Somebody wrote in this conversation, it helps you with not giving a fuck. It helps you with, and it does. There are times, like even right now, I'm going through a point in my life where I have extreme anxiety, okay? And I can barely think straight sometimes. And cannabis is what helps me to calm down. When you feel like, your world is crashing down, weed can help, okay? So that to me is medicinal. But I've also used it for pain. When I got into a car accident, my back was screwed up. I thought my back would never be right again. And headaches. Okay, I got what's today? Today's Monday. Got a headache on Saturday night hanging out with some friends. Yesterday, I used a whole bunch of CBD oil. I do not take Tylenol, Advil, ibuprofen. All that stuff causes your headaches to become worse. They're highly addictive. And when something's addictive, when you don't consume it, it causes the problem. Okay? Whereas cannabis, it helps to, because we have an endocannabinoid system, okay? We have an endocannabinoid system. So it's the endocannabinoid system, we have an endocannabinoid system just like a circulatory system, a respiratory system, a lymphatic system, an immune system, what else? Reproductive system, okay? The endocannabinoid system, okay? The endocannabinoid, circulatory, The endocannabinoid system modulates all of the other systems, okay? This is why there's so many applications for cannabis. So, so when you use it, when I use it for my headaches or whatever, it helps to balance what's going on. It's not addictive, and it actually helps to balance the system. All right, so that's what I do. That's what I'll use. So I do use it medicinally, right? When you have a medical card, it's just easier access because you don't have to pay as much, and you, like, let's say you're from New York, and New York is recreational. Okay, great. You go to Pennsylvania and you need medicine. And Pennsylvania, you have to have a medical card. Okay. And not every state takes cards from every state, which is ridiculous, okay? Some states will take cards from your state, some don't. And the thing with Washington, D.C., which I think is great, is Washington, D.C. is the one state where you self-certify yourself, which is how it should be. In Washington, D.C., you don't have to go to a doctor or a nurse to give you permission that you have a qualifying condition and now you can use cannabis medicinally. In D.C., you do it yourself. And I actually did that when I was in D.C., in May. Now, in DC it's about to pass recreational, so you won't need it to get it. But again, if you have the medical card, you don't have to pay the taxes. Sometimes you get more discounts. Okay. So yeah, like I just want to say that even with children, okay, cannabis medicine is being used in children for a variety of chronic health conditions, and it really can, like, people have to get this out of their mind of high weed heads all the time and understand that cannabis is a very special and potent medicine that can be used for a variety of things, that is not addictive, that will not kill you, and actually helps your body balance and balance its systems. Okay? So if you know somebody that's suffering with migraines, you know somebody that has cancer, somebody that is going through chemo and radiation, somebody that went through it and they have after pains, okay? Somebody that had a stroke. You want to prevent having a stroke, okay? And even there's a lot of brain things, as well. But pain, inflammation, all of that stuff. Preventing infections, okay? Somebody gets surgery and they want to prevent an infection. They can use it topically. Cannabis-infused coconut oil, you can use it topically to prevent infections. It's super antimicrobial. To help alleviate the pain and the inflammation. It could be used for all three of those things, as opposed to the anti-inflammatory NSAIDs or opioids that the doctor gives you. That is highly addictive and can kill you and stops your body from healing. Okay? So just understand, like, in cancer is becoming like the fastest growing rate of cancer is in children, okay? Children. There are a lot of children getting brain tumors. I have known a few people who have lost children from their child having a brain tumor. Okay, so the fastest growing rate of cancer is in kids, but there's a lot of adults with cancer. Cancer is becoming extremely common, okay? And there's a lot of lifestyle things that go along with that, with preventing it, and if you have it, there's a lot of lifestyle things that go along with not making it worse and trying to kill the cancer, because it can be killed, okay? But even within that, cannabis, not only, yes, it has anti-cancer properties, but it can really help with the symptoms that people experience when they are going through chemo and radiation. My dad had a friend, an older woman, who had breast cancer, and after radiation, she was in a lot of pain. A lot of pain, a lot of swelling. I told her to do castor oil packs, okay? And to use the cannabis oil. The cannabis oil will help with the pain, will help with the swelling, as will the castor oil, okay? So these are the things the doctors won't tell you. They'll just try to keep giving you pills and pills and pills that actually are addictive and sometimes don't even work. And in my family, I have one of my other aunts, she used to be a head nurse, a very top head honcho nurse in the DC area. She's in her 70s, and she's like, nurses can be very aggressive. they know their thing. But her being in her 70s, I'm sure she knows very little about cannabis medicine, okay? And I would like to help my other aunts. And I'm just like, look, it's your body, you know, to my mom. You can tell your sister, like, you know, if she wants me to talk to her about it and guide her through it, I will. Because I would like for her not to be suffering. She's really suffering. You know, the medications that they give you to make you constipated. And cannabis, when you're ingesting it, it can help with gastrointestinal issues and all those things. And so I'm not at a point of trying to hide things. I can speak about it on a scientific level. And the doctors and the nurses who don't know need to catch up. And all I'm going to do is be educating, like I've always done when it comes to health and nutrition and stuff like that. And I'm always here for those who need guidance or need help, okay? So, like I always say, I'm always available to do one-on-one consultations. You can definitely email me at thebodyscientist81@gmail.com. I know I need to have this all in a site, okay? I'm just so scatterbrained with all the things I have going on in my life. It's like my brain is always in 20 different places, and I really need a team to just come take the stuff out of my head and do it. So I'm getting it together. Life is forcing me to get my stuff on one site so you guys can go and just see your options. But for now, you can contact me, okay? Because I'm definitely going to be moving into bridging the gap with cannabis medicine, because people might know, somebody might know, okay, I can use cannabis for this, but how? How do I do it? Where do I start? What do I get? They can go to the dispensary and they don't really know. And even if you go to the dispensary, the people at the dispensary are not spending enough time with you, like really evaluating you and finding out what's going on, and you know how it can interact with the medications that you're on. Now, Virginia and Connecticut, I don't know if in any other states, but I know Virginia and Connecticut, they actually have pharmacists that work in the dispensaries. But I don't know how much time they really spend with people with that, you know. So that is one thing I'm going to be adding to my coaching. If somebody wants to use cannabis medicinally for what they're going through, I can definitely educate them and coach them through it, okay? But I just had to make this video real quick because I'm just like, not only there's so many applications, I feel like the elderly people are always trying to dump medications on them. And when it comes to my parents, I have to fight against that because those medications are unnecessary. And they really convince you that you have to be on these damn medications. And they're doing it with kids too, because school teachers tell me all these kids are on meds. They're all on ADD meds, they're allergy meds, they can't eat this, they got, you know, so people are getting sicker and sicker. And they keep telling us that we're living longer, and that's the reason why we're seeing these epidemics. No, first of all, that's not true. We're not living longer. Let's go to anthropology and archaeology. That's not true, okay? We're actually sicker than we've ever been since we've been on this planet. The children now are the sickest that children have ever been since we've been on this planet. And they're the first generation of children that are not expected to live as long as their parents. That's a problem, okay? Of course, nutrition is the backbone to that conversation. The backbone. But I think I've said what I needed to say. And of course, when I'm done, I'm going to remember things I didn't say. And of course, I will make other videos. And I'm going to be doing, you know, more case studies on my OnlyFans page, The Body Scientist, where I can actually go into depth about what protocols I would, you know, suggest to a person or have suggested to a person. And fibroids is the issue I'm going to talk about soon, because that's one that I haven't really spoken about that's coming up a lot. So look out for that soon. But yeah, I'm going to go on about my day. I just came out the supermarket and this was on my mind because I was on the phone with my mom and I was just like, I gotta make this because it's been on my mind a lot with the elderly. So yeah, whatever I didn't say, I'll say in the next video. But if you guys learned something from this video, please like it, please share it, please follow me on Instagram and on YouTube, okay, because I don't always post the same things on both pages. So follow me in both places and share with your friends, share with anybody you think it could help. If you want to contact me about evaluations, feel free to email me Yeah, there'll be discussion on fibroids very soon. And yeah, some of the research I've been doing has been disturbing. But very soon, okay? So have a good evening, guys. Thank you for listening. Please share it if it helped you. You feel like it can help somebody. And have a good evening. Bye.